Welcome to the City of Toronto's COVID-19 media briefing for Wednesday, April the 15th, 2020. Joining us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mr. Mayor.
Brad, thank you and good afternoon. As you all know, over the last number of weeks, we've been battling a deadly virus here in Toronto. We're doing everything we can as a team, as a municipal government and the Public Health Agency and many others who've been seconded to this war effort, as I call it, to confront COVID-19, with the focus being on protecting the health of the city and saving as many lives as we possibly can. And we've been joined all the way along in that fight by the Government of Canada, led by Prime Minister Trudeau, and by the Province of Ontario, led by Premier Doug Ford. We've all worked together throughout this crisis to save lives. In representing the interests of the people of the City of Toronto, I've spoken regularly to the Deputy Prime Minister in particular, Chrystia Freeland, and Premier Ford during the course of the emergency, as well as to numerous ministers in both governments. And we're all focused on helping people now and on rebuilding the economy and renewing the economy when this is over. But governments aren't alone in this fight against COVID-19. I'm very heartened by the fact that since the very early days of this pandemic, residents and businesses in the city have stepped forward to help. We're all in this together. City staff have received more than $1.5 million in donations so far in the form of contributions of personal protective equipment, food, and even household goods. We know people want to help the city's efforts in fighting COVID-19. It is the Toronto way. They want to help through community agencies to fight COVID, and many, in fact, want to volunteer. Today, I'm announcing that we've launched an online donation portal called DonateTO/COVID-19, and this is meant to serve as a one-stop shop for people who are looking to help with our efforts. Businesses and residents who are able to help can go to the site, which they will find through toronto.ca/COVID-19, to donate products, services, or money to the pandemic relief efforts. This will ensure that we're able to get donations to where they're needed the most as quickly as we possibly can. Some offers may be forwarded directly to our community agencies so that they can be received as quickly as possible by those agencies who are doing so much as our partners in the fight against COVID-19. While personal protective equipment remains most needed right now, including isolation gowns, level 2 and 3 surgical masks that meet Health Canada standards, thermometers, N95 respirators, we're also receiving donations from many companies to help with the city's food programs. These have come from a number of companies, including Metro, Sobeys, Loblaws, and Kraft Heinz. We've also received donations to our rapid rehousing project, including 2,084 units of cookware, dinnerware, towels, and bed linens from Hudson Bay, with a value of more than $300,000. Sleep Country donated more than $150,000 worth of mattresses and bases. And Winners, HomeSense, Unilever Canada, and Global Medic, in partnership with Procter & Gamble, have donated a variety of products to help us with the war effort, as I describe it. Confronting COVID-19 takes an all-hands-on-deck effort, and every day we're seeing the private sector, the not-for-profit sector, and the public sector all stepping up together with individual Torontonians to put that effort forward. It is this type of partnership that we are so used to seeing here in the City of Toronto. It's the Toronto way, and I want to thank those who've already reached out to help and hope that that will inspire more people who hear this announcement of the creation of this portal and themselves will want to sign up and help. I would also remind you that given increased demand on food banks, given the dislocation a lot of people are facing these days, that we would ask for your support, as you are accustomed to doing during the Thanksgiving food drive, to go to any fire hall in the City of Toronto to donate non-perishable food goods. Sadly, we know that there are many people in our city who need our help right now, some who have never needed help before and may be terrified of what comes next. And they need our support, they need our encouragement, they need our help now at this difficult time. And while these are tough times for many, we are working to make sure that we continue helping people when they need it the most. The mental health supports I announced last week helped many people over the holiday weekend, and I think it's appropriate to report back to you on the fact that people are using those. They were put there for a purpose, so that people who might not be feeling okay would nonetheless know that it was okay, as Chief Pegg told us, to call up and get support from these services that we put in place. 211, which is where you go to be connected in turn to the agencies that we've recruited to help us with mental health issues that people are facing, experienced a 90% increase in their call volume over the Easter weekend compared to the same weekend last year. A total of 1,739 more calls were warm transferred, so a live operator answering at 211 makes sure that you, the person calling in, get hooked up directly with an agency and people that can offer you help when you're calling in a stressful situation. So that represents at least 1,739 people who got some help or some counseling at a difficult moment for them. The Seniors Hotline experienced a 1,000% increase in seniors calls this weekend, around half the calls related to anxiety around financial security. The Gerstein Centre and Progress Place, who serve adults with mental health challenges, experienced much higher than normal call volume, with a majority of the calls coming, perhaps not surprisingly, between 10 o'clock at night and 2 o'clock in the morning. These are people at a lonely time of day that themselves may be lonely and under stress that are getting some help, thanks to the availability of those services through 211. And I would just remind you that they're there for your use and to provide support to you. CAFCAN experienced tripled call volumes, with the majority of calls on mental distress calls from Black children and youth concerned about domestic and sexual violence, and other calls related to lack of food access for Black seniors. The Kids Help Phone, including its crisis text line for youth, saw a 79% increase in the number of calls and texts received over the Easter weekend. But I'm told that 84% of the children and youth who called and texted Kids Help Phone over the weekend felt better and more hopeful and more in control as a result of the call when we got some feedback from them. It hurts me as mayor to know that so many people needed help over a weekend that is supposed to be a happy occasion. But I'm so glad that we were able to provide as a city and through 211 and these wonderful agencies that are our partners the help to people who needed it at the moment that they needed it, and I am very anxious for people to know that they can continue to reach out through 211 to get this help. People should know that you're not alone in difficult times in our city. We are working nonstop to make sure that our whole city gets through this and comes out stronger after all is said and done. This includes protecting essential workers in their workplaces right now. In an effort to stop the community spread of COVID-19, Toronto Public Health is visiting essential businesses, those that have been allowed to remain open, to provide these open businesses with advice and instructions on physical distancing, on cleaning and disinfecting. These visits are currently for education purposes, to raise awareness of the important practices essential businesses must take to protect their workers, those that are still going to work for us, and the patrons of orders issued as a result of the province's emergency declaration. The province announced yesterday that this act and this declaration will be extended until May the 12th to provide ongoing protection for the public's health. Given the extension, our Toronto Public Health will continue to provide education to businesses who I understand for the most part have been very cooperative. In general, Public Health has been extremely impressed with the level of effort made by these businesses, and I want to thank them for their very responsible approach to support their staff and support and protect the health of their customers as they continue to provide essential services for all of us. But Public Health has warned that if the advice and instructions are not implemented by these businesses, then, as has happened with other areas, enforcement may become necessary. I know this week, week 5, and in many cases I'm sure it seems much longer, but week 5 is the one that has really started to wear on people. I don't know why it's week 5, but I think it just has happened. I hear that in conversations I've had with people from all walks of life, and quite frankly that includes my own mother, who's getting impatient with some of the restrictions that we've imposed on people, including her and many, many others, of course, all of you across the city of Toronto. I say to her exactly what I say to you. We have come a long way, but as the public health experts continue to tell us, we still have a long way to go. That's not necessarily what you want to hear, but the fastest way we're going to get through this emergency and back to a much more normal life is by staying home, keeping our distance from others, buying only essentials once a week, and isolating yourself if you have any symptoms or test positive for COVID-19. It sounds simple on paper, but I know that all of these measures and these orders and these recommendations are not entirely easy to live with. As Dr. Davila reminds us every day, right now, tragically, people are dying from this disease. And the tragedy is not confined to the elderly or to the long-term care, as sad as those deaths are. We have other people from age groups and all walks of life that have fallen victim to this virus. Everything we are doing right now is to stop the spread of this virus, to save lives, and ultimately to protect our way of life. We will get through this, and we will, because I know the vast majority of people in the city and across the country want to do the right thing. They want to follow our doctors' orders, and they want to get back to their normal lives as soon as it is safe to do so. We are working hard on the restart right now. We've got that work underway because we know that day is coming. We are looking at what is being done elsewhere to get cities going as quickly as possible, but at the same time very mindful of the fact that public health must be number one in all of those considerations. We have begun an extensive planning effort to get this delicate matter right, keeping people safe and healthy while reopening the city and its economy and its way of life. The fastest way to get there is to follow Dr. Davila's advice. That's always been true since the beginning of this. It still is true today. And on that note, I will call on her to provide her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 2,670 cases of COVID-19 in Toronto. This includes 2,369 confirmed cases and 301 probable cases. There are 243 hospitalized and 94 in intensive care units. I was talking to my team yesterday, after yesterday's press conference, where I told you that based on my team's workload, we did not have updated numbers for the situation in long-term care. I sincerely felt bad. I felt very bad, having to tell you that we were not in a position to provide you with numbers. So I went back to the team and asked them to find a way for us to continue to focus on our outbreak response, to provide the important support needed in our long-term care homes who are dealing with outbreaks, while at the same time addressing the important information needs of our public. My team is working incredibly hard, and it was a tough ask for me to make of my team because they are already working at more than maximum capacity. However, as my team has done so many times before, they have risen to this occasion and figured out a workable solution to meet all the needs in a reasonable way. By definition, it is not going to be perfect. Landing and confirming the cause of death in these situations takes some time, especially when a number of deaths occur over a short period of time. Often, we don't have the definitive cause of death right away. Sometimes this takes weeks to occur. This is why, when it comes to infectious disease outbreaks in long-term care and in other congregate settings, we don't always know the complete picture on cause of death until after the outbreak is declared over. This is often what we see in influenza outbreaks in long-term care homes, and it is what we are seeing now as we respond to local COVID-19 outbreaks. The difference between the current COVID-19 outbreaks in long-term care homes and what we experience in regular influenza outbreaks is that with influenza outbreaks, there is not as much public interest in the data in real time. As of 12:30 this afternoon, there are 41 COVID-19 outbreaks in long-term care homes in Toronto. I've been asked to provide specific updates on the situations at Eatonville Care Centre, at Kipling Acres, and at Seven Oaks. At Eatonville Care Centre, a privately run long-term care home, there have been approximately 54 cases of COVID-19 and 23 deaths. at Kipling Acres, a long-term care home operated by the city, there have been approximately 23 cases of COVID-19 and 4 deaths. I would note that this is a higher number of cases than has been previously reported due to increased testing that has been recently completed. At Seven Oaks, another long-term care home also operated by the city, there have been approximately 96 cases of COVID-19, and sadly, there have been approximately 22 deaths. I've also been asked for an update on COVID-19 cases at the Willowdale Welcome Center. And to date, there have been approximately 20 clients identified with COVID-19, and thankfully there have been no deaths there. In total, 121 people have died of COVID-19 in Toronto. I would ask you to join me once again in extending our sincerest condolences to the families and friends of all the individuals who have lost loved ones, all the individuals who've lost their lives to COVID-19. These numbers are very concerning. And they're concerning because they represent our parents. They represent our grandparents. They represent our loved ones. And it makes me very, very sad to report on this information. Each and every day, we are learning more about how COVID-19 moves through our community and impacts those who are infected. Current evidence from jurisdictions all around the world shows that the vast majority of COVID-19 cases are mild to moderate. Approximately 20% of people infected with COVID-19 are considered severe enough to be hospitalized. Critical cases of COVID-19 may experience respiratory failure, septic shock, or multiple organ dysfunction and require care in an intensive care unit. If there is a spike in cases, as we have seen in parts of northern Italy and just to the south of us in New York, hospitals can quickly become overwhelmed with patients. Healthcare workers in these areas are operating under incredibly stressful conditions, triaging and caring for patients, some of whom are quite literally hovering between life and death. I would like to take this moment to sincerely thank our health system partners in Toronto for the outstanding work they are doing each and every day. I especially want to acknowledge all those working in hospitals, whether in direct patient care or in one of the many essential support functions that it takes to run a hospital. I'd like to thank all these people for providing outstanding care throughout this unprecedented situation. Lastly, I would like to take a moment to sincerely thank my team at Toronto Public Health. They are making many personal sacrifices and working tirelessly to keep our city safe. I am truly, truly very, very proud to work alongside them and consider it the highest privilege of my career to be part of such a team of incredible professionals. To ensure that our essential workers remain healthy and can provide care for our city, we must continue to practice physical distancing. So please, continue to stay home, stay safe, and take care of each other. I'll now hand it over to Chief Pegg.
Well, thank you, Dr. Davila, and good afternoon. All aspects of Emergency Operations Center operations continue on a 24/7 basis to ensure that both critical and essential services are being provided without interruption. Our personal protective equipment levels remain stable today, and our team continues to work hard to source the equipment that we need on a go-forward basis. This afternoon, I'd like to respond to a few operational questions that we've received. Toronto Police are hearing concerns from some business owners who feel that their properties are potentially at risk of criminal activity, given the reduced public traffic and customer flow. In response to these concerns, our police officers across the city are engaging with communities, providing assistance and education on how to take steps to protect businesses and property. Additional police patrols and enhanced police visibility is also occurring in order to deter crime. The Toronto Police Service continues to adapt to the changes the pandemic has brought about and is continuing to focus on being where the public needs them the most. As we all know, COVID-19 is placing extraordinary demands on many of our city staff, including our paramedics. When someone calls 911 during a medical emergency, during the COVID-19 situation, the emergency medical dispatcher that you speak to when you call 911 will ask a number of important screening questions to assist in determining the potential presence of COVID-19. In order to provide the right help, it is extremely important that callers clearly and honestly communicate their symptoms to the dispatcher. When paramedics arrive, here are a few things to remember to help protect everyone's health and safety. The arriving paramedics will conduct an initial assessment from 2 meters away from the patient in order to determine what specific personal protective equipment is required. We ask that you do not approach the paramedics until they have had time to complete this screening. The paramedic may ask the patient and/or others on the scene to put on a mask, which they will provide if required. When this happens, it is done to protect both the patient and the paramedics. Please respect physical distancing at all times by staying back at least 2 meters from our paramedics and our other first responders who are providing care to a patient. Toronto Paramedic Services continues to respond to medical emergency calls as normal and is committed to providing the best possible care to our community. If you'll permit me to step back into the fire chief role for a few minutes, I would like to update you on 2 tragic fires that occurred since our last press conference. At approximately 8:30 last night, Toronto Fire Services responded to a high-rise apartment fire on Rose Hill Avenue in the Yonge and St. Clair area. Unfortunately, during the course of search and rescue operations on the 29th floor, 1 occupant was located. Sadly, we received word overnight that this individual died as a result of their injuries. Further, shortly before 7:30 this morning, our crews also responded to a house fire on Taylor Drive in the Coxwell and O'Connor area of East York. During the course of search and rescue operations at this fire, 1 occupant was also located inside the home. Tragically, this occupant also died as a result of their injuries. First and foremost, I would like to extend my sincere condolences to family, friends, and all those impacted by these 2 tragic fires. As always, comprehensive investigations into the origin, cause, and circumstances of both fires are underway, in collaboration with Toronto Police and with our colleagues from the Ontario Office of the Fire Marshal. As a city, we continue to provide the essential and critical services that our residents both need and rely on each and every day in Toronto. I'm proud of every member of our City of Toronto team who continues to work hard in support of our residents each day. Thank you.
Thank you, Chief Pegg. We'll go to our first question. Just a reminder to everybody on the line that limit to 2 questions each as well. For those who are asking, Marianne Bedard from Shelter Support and Housing is on the line. If you do have a question, we can answer it that way. First question goes to Jennifer Pagliaro at the Toronto Star. Go ahead, Jen.
Hi there. For Dr. Davila, I appreciate your statement about the numbers concerning long-term care homes and the update on those 3 homes. I am just wondering, though, in terms of transparency, if there will come a point where we are able to see the numbers at each of those individual homes on a regular basis, because I think that's something that the public is looking for, and we're obviously hoping to provide those numbers to them.
So thanks, Jennifer, and I appreciate that ask and interest on the part of the media and the public. That's exactly what I've asked the team to go back and take a look at. So today I was able to provide some numbers in respect of situations that are of particular interest. So we've provided those numbers, but the plan is to provide numbers in a fashion that people can go and look them up and see for themselves what's happening within long-term care homes.
Okay, and I think probably for Chief Pegg and maybe for Mayor Tory, we saw in California and some other Western states that they're preparing plans for when stay-at-home orders are lifted, including different indicators for when that might happen. And I wonder if the city is looking at a similar type plan, or if the province is working on that and the city is aware of that.
Well, I think the answer is both. There is a provincial table at which we're represented by our Chief Medical Officer of Health, which is beginning to look at some of these kinds of questions, but we've also begun very active and intensive efforts within the City of Toronto. But we'll be guided very much by what the public health advice is to us, because of course there's going to be no point in having some kind of a reopening program for the city and for the economy if it puts health back at risk and when we're just coming out of a pandemic situation. And so I think we'll have some further news in the next couple of days about the process and the structure that we're using to put together what amounts to a very complicated plan. One of the things we're doing is looking at what other cities are doing, and you realize the complexity of what opens when, who goes back to work when, what testing do you do, how do we match up various city services, including public transit, with those realities, and on it goes. So, but we're very actively at work on it because we want to have a plan ready so that we can have it happen in an orderly, but most of all a safe and healthy manner when the time comes.
And Jen, what I can add to that is what is asked of me in this role, and by extension our Emergency Operations Center team, is to operationalize, I would say, any of the plans that Mayor Tory spoke about. So the key role of the EOC is to translate any plans that are created into action, if you will, and I can assure you that we are fully connected not only with the Mayor and his task force, but with the City Manager's office and all of the cross-disciplinary team that are looking at both recovery and economic restart.
Great, thank you. We'll go now to Francine Copeland from the Toronto Star. Francine?
Oh, hi. You'll have to excuse the noise in the background. My question is for Dr. Davila. Dr. Davila, yesterday we learned that there were 30 cases of COVID-19 at 7 shelters in the city. I'm wondering if you could update that figure for us today.
Unfortunately, Francine, I don't have specifics on that today. I was able to provide some information in respect of the Willowdale Welcome Center, and happy to provide you with further updates. I just don't have that data with me today.
Did you have a follow-up, Francine?
No, that's it. Thank you.
Okay, thank you. Okay, next we go to Matt Bingley from Global News. Matt, go ahead.
Hi, my question is for Chief Pegg. You mentioned the police presence in response to the concerns of several businesses about the risk of burglary. We've obviously seen a lot of storefronts put up plywood. Is that something that you would really sort of suggest? And I'm just wondering if you can break down any numbers of just sort of what we're actually seeing in terms of crime when it comes to the opportunity that thieves have had.
Sure, thanks, Matt. So with respect to numbers, I would have to defer to my colleagues at Toronto Police. What I can say about, with respect to the police activity, what they refer to as directed patrols are based on intelligence-led information that allows us to focus on the areas that may be susceptible to that type of crime. There is a number of important pieces of information available to business owners and the public, available on the Toronto Police website at torontopolice.on.ca. And our police colleagues are providing some important information on their website with respect to how business owners can appropriately secure their properties and where that may be appropriate. I should also add business owners can also contact the crime prevention officer in their local police division for both advice or support.
And to Dr. Davila, thank you for the numbers. I'm just wondering, when it comes to just a more comprehensive look at who's being treated and some of the deaths that we've seen, are you able to sort of tell us who were higher risk and break down who maybe a little bit younger and people that we wouldn't really sort of think of as being someone who would be in that long-term care home setting as part of a victimology here?
So as I've mentioned earlier, I have asked my team to provide more data. How quickly they'll be able to provide that very broken down, very detailed level of analysis, I'll continue to work with them towards. I think in the first instance, what we're going to try to do is make sure that there is more broadly available to the public, including the members of the media, information around outbreaks, number of cases, and certainly numbers of deaths. As we are going to continue to focus, of course, on providing support to long-term care homes in outbreak, and that has to be another area of focus for us. As we are able to provide more resource to this, of course, we're interested in providing more detailed information. It helps to inform our actions, and certainly it helps to inform the public. But I think we're going to try to do this in a very graduated and responsible fashion, in a manner that meets the needs as best as possible, whether we're talking about information needs or the outbreak support needs within long-term care homes.
Okay, thank you. Francine Copen does have a follow-up for Marianne Bedard, who is on the line. So Francine, please go ahead.
Yes, for Marianne Bedard. This afternoon there was a protest at City Hall. They were socially distancing themselves from each other, but it was a protest. And I think what they were basically saying is that the city isn't moving fast enough to create social distancing in shelters. How do you respond to that criticism?
Thank you for the question. I recognize that this is a time where people feel that we need to move very, very swiftly. And as I spoke of yesterday, that the city has engaged in a very swift and significant response. We have been able to move more than 1,000 people in just a matter of a few weeks, in addition to a number of other actions that are going on in the background to increase safety within the shelter system. I know it's very frustrating. I recognize that this is a very vulnerable group, but I can assure the public that we are moving with all urgency.
Okay, thank you, Marianne. We'll now go to Scott Lightfoot from CTV News. Go ahead, Scott.
Thanks, Brent. Question for Marianne, and if the mayor wants to jump in as well, he can. Sanctuary, which of course is not a city-run facility that deals with homeless, have started a tent drive, and they're allowing people to set up tents on their property because they believe the shelters are still too crowded and that the homeless population not being moved into hotels or other centers fast enough. What do you make of this idea of allowing people to camp out in tents at this point?
Well, as you said, this is an independent private organization, but I can tell you that our Streets to Homes personnel have been working very closely with the organization to offer support to the people that are there, and we continue to do that. Anyone staying outside, we are committed to working with, to encourage them to come inside into safe spaces, as well as accessing other resources through our Streets to Homes teams.
I would only add to that, first of all, my commendation to our public service staff, because if you think of the challenge of moving so far, 1,000 people, and doing it in a sensitive manner that takes into account the fact that many of these people are vulnerable with very special issues facing them, not just the fact that they have to be moved from one place to another. I think that this is a very significant accomplishment and that it's not over. There are more that are being moved as we speak. I don't encourage people to locate themselves in tents. I do commend the fact that our Streets to Homes people are still working to make sure that there are other alternatives available, including the hotels that are now in use. And I would say, had we moved too rapidly and insensitively to move very vulnerable people and get it done faster, but not do it in a way that was sensitive and took account of those particular needs, we'd be criticized for that. And what we're doing here is doing it carefully, but we're doing it as quickly as possible, and it's going to be involving thousands of people when it's all said and done. 1,000 moved already, and I think that's a significant accomplishment, and I thank the public servants and the nonprofit and other people for the work they've done to accomplish that so far, and much more to come.
And for anyone on the table, because you're all involved in sort of the future planning of this, knowing what you know about how this virus spreads, community spread-wise, do you expect that when restrictions start being relaxed, those relaxations could be, I don't even think that's a word, but they could be different in Toronto versus other smaller communities just due to the number of people and the density of people in this city?
Yes, I'll start off, and perhaps my colleagues will add more. But I do think we have to consider the unique circumstances that we have here in the City of Toronto. That has to be part of the calculation. We are in a different situation. We have a different density. We have a number of different services, including a major public transit system, big businesses, large congregate settings. I think we have a number of unique circumstances in our city that will have to be taken into consideration. But I would imagine that all jurisdictions, as they seek to restore some degree of regularity into their own respective cities or towns, have to think about what the unique circumstances are and how to best manage that and balance out what is appropriate for public health and from a public health perspective, along with restoring, social life and economic life to our respective cities.
I'll just say that we are working very closely in cooperation with other big cities. This city is as big as many or most of the provinces in Canada and has its own unique considerations, as Dr. Davila said, including in particular something like the public transit system, which moves 1.5 million people every single day. And those are considerations other cities, or the province for that matter, don't have to take into account. But we'll be working hand in glove as well, as we have throughout this, with the province and with the federal government, because through collaboration we will get a better plan in the end. But we're going to have a Made in Toronto plan that is not only going to affect the needs and address, with the advice of our public health officials, the keeping people healthy and getting them back to work, but also getting people in a way that they can kind of celebrate the reopening of the city and shop local and dine local and do all those things to support a lot of these small businesses that have been very badly hurt. But we'll do it in a Made in Toronto way, because I think it's important given the unique characteristics of this city relative to any other place, frankly, in Canada.
Okay, thank you. We'll now go to Mark McAllister from City News. Go ahead, Mark.
Dr. Davila, if you would, you've mentioned a couple of times about asking your team to gather more data to try and provide more detail in the numbers. I'm wondering if in doing that, there's a consideration to possibly break it down by ward or postal codes, perhaps socioeconomic status, whether we're going to get any indication as to groups beyond the ones we already know, or areas in the city where this is probably more a problem than others.
So that's an excellent question, and I will tell you, in the world of public health, we're always interested in more data because it actually is incredibly important to us in terms of informing actions and informing our response. So as I've indicated, trying to be sensitive to the needs of the team. They are trying to manage a number of outbreaks and conduct case and contact investigations and provide responses and answers to questions to a wide variety of partners and members of the public in respect of COVID-19. So they have their hands quite full. However, we are interested in making sure that we're addressing the information needs of our public and ourselves and the media as well. So these are active conversations, very much interested in providing a fulsome picture of COVID-19 in our city. It helps to drive our response and ensure that we're directing our action appropriately, and certainly it's of interest to our public. So this is, as I mentioned, an active conversation. We will continue to try to provide as much information as possible in as timely a fashion as possible.
Perhaps, Mayor Tory, if you could follow up on that. I don't know, you're taking your cues, obviously, from the medical officer of health, but do you have a specific interest in knowing where in the city this might be a problem, or who this is affecting beyond our senior citizens?
Yes, I do, and I think the medical officer of health herself indicated that that does help to fashion our response, and I've heard her say prior to today that information can be drawn out of the records, as much as there's many things that people are doing right now to try and fight this pandemic. And so I'm sure as that information can be drawn out and made available, it will help to better inform the public. We have no reason other than to be very transparent about that kind of thing. These are just facts, very sad facts, but they're facts. And so I would hope that as the staff get time to pull some of these things out and make them known to the public, that will in fact happen. And I've heard nothing but an embracing of that idea from the Medical Officer of Health when she's been asked about it.
Okay, one last follow-up now from Jennifer Pagliaro from the Toronto Star. Go ahead, Jen.
Hey, thanks. I'm just wanting to add, in terms of the numbers, whether it's possible, and I know this is asking again for additional work, but we're constantly asking about the shelter numbers. I think you mentioned the current number for Willowdale. I'm not sure if that includes shelter staff or just clients, and whether or not it's possible to get individual numbers of shelters and agencies as well.
So thanks, Jennifer. The number I provided in respect of the Willowdale Welcome Centre was with respect to clients. We are certainly trying to work on making as much data available as possible. Shelters are certainly on the list, but I would just ask that you give us the time to work our way through. We are working our absolute hardest to try to put this information out there in order to inform the public and the media. We know that this is an important piece of information that you would like to have, and I assure you they are working very hard to try to put that out there.
Okay, thank you very much, everybody, for joining us, and we'll be here again tomorrow at 3:45.